Let's use a plastic block to demonstrate the proper technique. It is helpful to divide the canal into thirds: coronal, middle, and apical. We will begin by instrumenting the coronal part of the canal. Gates Glidden drills 2, 3, and 4, or instruments of your choice, are used to flare the coronal part of the canal. Irrigate as required. Determine the working length with at least a 15K type file. We measure the distance from the reference point to the end of the canal. This is the canal length, which measures 16 millimeters. To approximate the location of an apical constriction, we instrument and obturate 1 millimeter short of the foramen, making our working length 15 millimeters. We recommend using an electronic foramen locator. Ensure canal patency to working length with at least a size 15. File with the 15 until it feels loose. Creating a clear path to working length is critical. The canal is now ready for apical instrumentation. Begin with the size 20 LightSpeed. This small size encounters no resistance, so it is advanced to working length and withdrawn. With the next larger size, there is still no resistance. This indicates that the blade is still not cutting. With a 30, there is still no resistance. This indicates that the canal is larger than the blade. Continue with the 35. Some resistance is felt. We pause here to emphasize that when resistance is first felt, pause before slowly pushing to working length. Since the 35 is cutting the canal and generating debris, it is time to irrigate. Irrigate after every instrument that cuts. The irrigation sequence is as follows. Irrigate until the solution is clear. Applying suction while irrigating enhances debris removal. Flood the canal and chamber with liquid EDTA and do not suction it out. Let's go to the next instrument, a 40. When resistance to apical advancement is felt, pause briefly, then slowly push to working length. Remember to irrigate. The 45 encounters resistance. Pause, then slowly push to working length. It requires a firm push. Because the 45 required a firm push to reach working length in the apical 5 millimeters, the 45 is the final apical size, or FAS. Canals are three-dimensional. They have both a working length and a working width. The correct final apical size ensures that the apical canal is instrumented to its correct working width. The final apical size varies from canal to canal. It is the instrument size that is slightly larger than the original canal size, ensuring that all canal walls in the apical part are instrumented. This root was cross-sectioned about 1 millimeter from the apex. We will use it to demonstrate the concept of working width and how the final apical size is determined. The LightSpeed 30 is approaching working length. No resistance is felt because it is not cutting any canal walls. As the 35 reaches working length, some resistance is felt, indicating the LightSpeed has begun to cut the canal walls. More resistance is felt with the 40, indicating that more cutting is taking place. With the 45, significant resistance to apical advancement is felt, It requires a firm push in the apical 5 millimeters to reach working length, indicating that it's the final apical size. The oval canal has been cut round, indicating that all walls have been cut and cleaned, the goal of instrumentation. LightSpeed's unique design, with its short cutting blade and non-cutting shaft, gives you excellent tactile feedback. With a little practice, you will be able to accurately determine when the apical canal has been correctly instrumented. Working widths of canals vary widely from tooth to tooth. Therefore, you should expect final apical sizes to vary as well. With the next larger instrument, a 50, instrument 4 millimeters short of working length. This shapes the apical part of the canal so that a simplifill obturator fits properly. The mid-root is cleaned and shaped with the next 3 LightSpeed sizes. The size 55 is advanced to resistance, then pushed 2 millimeters apically. Be careful not to advance any mid-root instrument to within 5 millimeters of working length. This may result in a loose-fitting simplifill plug. Each larger mid-root instrument meets resistance more coronally, resulting in a tapered preparation. This completes the mid-root preparation. Recapitulate to ensure that the final apical size goes easily to working length without encountering any obstructions. Confirm that the working length was maintained. Then stop the handpiece and confirm the existence of an apical stop. Try to push the final apical size instrument past the working length. It should not advance. Complete the cleaning and shaping procedure by irrigating with sodium hypochlorite, chlorhexidine, or the irrigant of your choice. Suction, and do a final rinse with liquid EDTA, then dry the canal with paper points. Once you have confirmed that the canal is clean and free of debris, the canal is ready for obturation.